Hey everyone, Dr. Sarah Griffin from Western New York Spinal Solutions back with installment 2 of our 5 video series on how stress can affect our bodies and what we can do about it. In particular, this video is going to focus on some of the things we can do when I have pain, I have it now, and I can't get in to see my chiropractor, my massage therapist, my physical therapist, my acupuncturist, whatever it may be you use to help you with your pain. So these are some passive things that I tend to recommend for my patients when they're feeling pain. And a later video series is going to focus on some of um, the active things we can do to help our pain. Later in the series, there will be a video to address that. So, first things first, is this a chronic issue or is it an acute issue? More often than not, when we're thinking of something that's painful, we often are thinking of it as inflamed. But that being said, not every condition is painful just solely due to inflammation. So then you can kind of look at that heat ice paradigm and what we should do for it. More often than not, when my patients come in, I will look at them and make a recommendation based on their current condition. So that may mean that one day I'm telling them to heat and the next day I'm telling them to ice. So by no means am I making a blanket statement for anyone out there with low back pain. You should do X. But more often than not, if an injury is new, say you were gardening in the backyard and you did a couple hours of mulch and some digging and some moving of bricks, whatever it may be, you're working on the garden for a couple hours, you come in, your low back is really sore. Okay. Well, there's been a lot of activity there. More often than not, in this situation, I would recommend a patient throw on something topical like some biofreeze. The nice thing about biofreeze is the mentholatum, that pepperminty kind of smell you get from biofreeze, actually acts as a sensory disruption to the pain signal getting through to the brain. So while you're wearing it, that tingly, cool sensation you're getting is actually blocking some of that pain signal that your low back is sending to your brain. So yes, it's only usually effective while you have it on, but there is a little bit of a natural anti-inflammatory also in biofreeze, which helps knock down pain signal for a prolonged period of time, even after that mentholatum has worn off. Now, I'm not promoting Biofreeze in particular. It's a brand we sell in my office, but people can use China Gel or Icy Hot to a similar effect in this way, where you'll have that topical application will actually help block some of the pain signal from getting through. Okay. Then you can also do, and this is something I would highlight, if you just did something that day that has aggravated your condition, try icing. Okay. It's an acute area. It's acute injury. There's probably some inflammation built up in the area, a little extra blood flow. You don't have to go crazy. Think the thicker the tissue, the longer you ice. In reverse, the thinner the tissue, the less you ice. So thinking about wrists or elbows, you're going to want to go very small amounts of time, particularly if you're a small patient, 3 to 5 minutes, or when things start getting numb, you're good. A little bit of ice will go a long way. Lower back, you can go closer to 10 to 15 minutes. After the icing period, take the rest of the hour off. You want to restore normal blood flow to your tissues. The old 10 on, 10 off, or 20 on, 20 off. I usually tell my patients go for no more than once an hour. Restore normal blood flow so your body does not think you're freezing and send more blood flow to the area and make it worse. Please do not sleep on an ice pack unless it's one that cools off or warms up very quickly. Now, looking in terms of a chronic injury where you might have more muscle tonicity or tension built up there, heat might be the way to go in this situation, where a little bit of extra blood flow will help relax the muscle and soothe the area, whereas ice would kind of constrict everything more. So in those situations where if you have chronic low back pain and you wake up first thing in the morning and you're having a tough time getting going, maybe a little bit of heat might help loosen up the muscles so that you can do some light stretching and follow up with ice afterwards. Um, Also, in regards to ice, a cool thing you can do is try a little at-home ice massage. So if you get a Dixie cup, you fill it about halfway full with water, freeze it, and then take off the outside of the cup. If you just hold the bottom of the cup, you can use it on things like your forearm after you play tennis or golf, and do a little massage while you're icing. Whereas that edge of the ice can kind of cut into the tissues, and you get a little 2 for 1. That's a nice option. Finally, anything natural that's anti-inflammatory. As a chiropractor, I cannot promote that you take ibuprofen or Tylenol or Aleve, but taking anything that's natural, that's my wheelhouse. So ginger, turmeric, even fish oils, things like that. Fish oils in high doses are anti-inflammatory. Ginger is a great thing you can cook with, and that is a natural anti-inflammatory. Turmeric, don't forget to activate turmeric. You're gonna, cook. If you're gonna cook with it, you have to cook with a little black pepper to activate that turmeric. But those are all natural things you can do. Shake some into your smoothie. Bromelain, which is a pineapple enzyme. Who doesn't like a little fruity drink first thing in the morning? Take some of that. That's a nice natural anti-inflammatory. And a lot of these you can toss into a smoothie or a shake quite easily. So those are some options for I have pain, I have it now, until you can get in to see your chiropractor or your massage therapist or whatever it may be. So try some of those and let me know how they work for you. Dr. Sarah Griffin, Western Spinal Solutions. See you soon.